today. We are very excited to be here from the American Institute of Dental Public Health to talk about veteran oral health in Idaho. Thank you for being here today. All right. There might be some folks coming in from the waiting room. I'm Liz Flannery. I'm the Director of Education and Leadership here at AIDPH. Annalise Cothran, our Executive Director and co-founder, is on the line. And Shayla Stewart, our Education Specialist, is on the line as well. You'll be hearing from them in the chat as they check in. And I will get started here. You will hear from me in just a minute that this is designed to be a very interactive session. So we invite you to chime in the chat, participate in the discussion methods. I see almost everyone here is on video. That's fantastic. So we're going to go ahead and get started. Okay. So again, I'm going to give us an introduction and an overview. We're going to talk about a national overview of veteran oral health, and then we'll dive into the specifics about Idaho and look at your data. Again, we're going to have discussion throughout the session. We want to hear from you about what resources you need for solutions, and then we'll talk about next steps. Some housekeeping pieces. We are recording this session. Slides, the recording materials will be available in our academy, which we will include information on how to get there at the end of this session. We invite you, this again is designed to be interactive. We want to hear from you, and we also want to give you space to connect with your colleagues in your state who are working on veteran oral health, who are working in dental public health. So please take a moment to introduce yourself in the chat. Feel free to share your email, your organization, and chat with each other throughout. If you have any troubleshooting questions, again, we have Shayla here. She can help you out in the chat as well. Okay, so we are going to ask you several questions throughout this session. We are going to use Slido to help us engage. So if you want to take a moment and scan this QR code, that will bring you directly to the Slido session for this seminar. We are also going to post slido.com in the chat, as well as this reference number here. So if at any point you close your window, you don't have the QR code, you can go to slido.com and post this code that we will put in the chat in Slido and see the polls that we're asking you guys. So we'll give you a second there, and we're gonna get started and make sure everyone has it in just a second here. Okay. We good on the chat, Shayla? We have it. Okay. We'll go to the next slide then. These are our learning objectives for our session here today. They will be reflected in the Academy as well, and these are tied to the CEU that is available for this seminar. Okay, so we are going to warm ourselves up with Slido. If you want to pull your phone up or your web browser, whichever you went to, and toggle over to that website. Again, it's in the chat if you weren't able to open it before, and we want to hear from you about what brought you to today's session. Are you here to learn, to share, to connect, or act, or perhaps all four of those things? And we want to know what you're here for, and this will also give us a little trial to make sure we're all warmed up on Slido. Learn all of the above. I love seeing all of the above. Connect, great. I hope you're making those connections in the chat. Okay. All right. Fantastic. It looks like we're all good and have access there. See a few more folks chiming in. I'm going to toggle back, but if you haven't responded yet, please feel free to still share on here. It won't close. Okay, great. Just some more housekeeping. I am the presenter for our session here today and sharing that I do not have any disclosures to share. Again, I'm Elizabeth Flannery. I'm the Director of Education and Leadership here at AIDPH. Shayla Stewart is our Education and Leadership Specialist. And we want to say a big thank you to Jennifer Wheeler, Executive Director of Idaho Oral Health Alliance, for being our contact and hosting us here today, for communicating out to all of you about this session and making sure that we had Idaho stakeholders on this call. Thank you, Jennifer, for being a wonderful partner and supporting us in this work. Okay, we're going to go back to Slido again. And as we're getting started, we want to know, what do you believe are the top priority areas for veteran oral health in your state? And this will really help us tailor our content on our seminar here today. Okay, so we have access to care, oral health literacy, workforce development, policy advocacy, access to care. Okay. Oh, wait. Okay. Oral health literacy. I see access to care staying the largest priority there. Um, and some of you may or may not know, we have a current goal to give this seminar in every state of our country. We have several under our belt now. I think we're about at 50% of states in the country, and I think access to care has been the highest rated in every single seminar that we've given. Okay. All right. Thank you for participating. All right, I'm gonna toggle us back to our slides and we can go ahead and get started here. So just a quick overview of who we are as AIDPH and why we are the folks here talking about veteran oral health. We are a 501c3 nonprofit. Our mission is to empower our community to advance oral health through science, education, and advocacy. We are taking the research that our research and impact team did and hosting education sessions on it. So folks know about the tools we created. We never conduct research just to conduct research. We always want them to be translatable. We want to take that data and put it into tools that folks can use in programming, in advocacy, et cetera, to advance oral health. We do this work because we have a vision of a justice-oriented oral health system. So thank you for being part of this work and joining us here today to learn more about the data in your state. We have 4 communities of focus at AIDPH that includes LGBTQIA plus people, veterans, which we're specifically talking about here today, people with disabilities, and people living in rural communities. But we understand, of course, that there's intersectionality on these 4 communities of focus. Specific to what we're talking about here today, and you'll hear more as we dive into the data, approximately 30% of veterans report having a disability. Approximately 25% of veterans live in a rural area, something we're really going to talk more about. And all have the common experience of historic exclusion and marginalization from healthcare systems. As we're getting started, we want to take a minute and thank our partner, CareQuest Institute for Oral Health, for funding this work. And we have a long-standing relationship with CareQuest and a specific partnership around veteran oral health. And this is just a timeline showing kind of the breadth and the depth of this work. We are here to talk about state profiles on veteran oral health, which is a great tool that lets you dive into the data specific to your state. But we have a lot of research on veteran oral health at the national level and in specific topics. We'll share the website vetdentaldata.org throughout this call, which is a compendium of all of our work on veteran oral health. And you'll see this timeline here, that the work that we've done through this timeline is reflected on that website, which has also allowed us to participate in advocacy, including Hill Days, research pieces, et cetera. And this series where we're going out and talking to folks directly in the states. Okay, so what does veteran oral health look like nationally? We'll start at the top and then we'll dive in deeper. So looking at a national overview, this might be familiar to some of you. We've found through doing this work that many people, sometimes veterans themselves, aren't fully aware of how VA medical and dental benefits actually work. I'll take a moment and say that I am not the spouse of a veteran, but I'm the spouse of an active duty military service person and have experience receiving those benefits. Annalise is the spouse of a veteran. And so it's something that's near and dear to us, both professionally and personally, as well as some personal experience working within these systems. And we understand how it can be confusing. So again, not understanding the eligibility process, what care veterans can receive, or even where and how they can access that care. And that's why we like to begin by setting the stage with a clear picture of what's currently available through the VA and what veteran oral health looks like at the national level. So the key point to take away here is that eligibility for medical and dental care through the VA is not set by the VA itself. It's determined by Congress through a federal law called Title 38, and that law outlines what care is covered, who qualifies, how much it costs, and where it can be delivered. And because of that, any major change like expanding dental coverage requires congressional action. So it's not just a policy update, it involves passing new legislation and then securing federal funding to support that legislation. So when we talk about the limitations in access to dental care for veterans through the VA, it ties back to laws at the federal level. That being said, I also want to point out that that doesn't mean we can't take action to impact change at the local and state levels. It really takes getting educated, like we're doing here today, and collaborating with our local communities. We'll talk about some specific examples that states have taken that have really driven change for veteran oral health at the state level. Okay. So looking at that a little bit more, currently most veterans aren't eligible for dental care through the VA. So looking at this graphic, that top row of people you see there represents all veterans living in the US today. The lighter colored half shows the veterans who are either receive care outside the VA or aren't eligible for VA health care at all. And as you move to the left on the chart, the darker blue section represents the nearly 9 million veterans enrolled in VA healthcare. But of those, only a tiny fraction, that very small blue and red segment, is actually eligible for dental care through the VA. And what that means in practice is that veterans might go to the VA for a medical appointment, get treatment for chronic condition, but they're still leaving with untreated dental pain because they aren't eligible for dental care. So the other piece is that even among the about 1.8 million veterans who are eligible for dental benefits, only about a third of them actually use those dental benefits. So we need more data to understand really kind of the why there, but barriers to care and lack of awareness can play a big role in that utilization rate. Okay. So looking at that a little bit more with chronic disease. So veterans living with chronic conditions like heart disease and diabetes are especially vulnerable to oral health issues. So what's even more concerning when we're looking at that is that veterans with these high risk, high cost conditions are more likely to lose all of their permanent teeth. And we see poor oral health outcomes for veterans than non-veterans, even when they've seen a dentist in the past year. So that tells us that access alone isn't solving the problem because even when veterans are getting dental care, many still face some of the worst oral health outcomes. And a big reason for that is lack of integrated care. These chronic conditions aren't being addressed in coordination with oral health needs, which is part of that poor oral health outcome. And also why it can be really frustrating. The VA is the largest integrated healthcare system in the country, uniquely positioned to manage complex care for veterans with multiple chronic conditions. But since most veterans aren't eligible for dental care through the VA, we're missing out on that critical coordinated care piece. Okay, let's look at this a little more specifically. So this is coming from recent research from AIDPH conducted in partnership with CareQuest and really focuses on the connection between chronic disease and oral health. So even after controlling for factors like income, education, and whether someone lives in a rural area, we found that veterans with diabetes are still 40% more likely to be edentulous, meaning they have lost all of their natural teeth, compared to veterans without diabetes. And just as concerning are the findings related to heart disease. Veterans with heart disease were 30% more likely to be completely edentulous compared to veterans without heart disease. And really reinforcing that what we're seeing across the board is that chronic conditions like heart disease and diabetes have a significant impact on oral health outcomes for veterans, even beyond other contributing factors. Okay. So what we want to really highlight here is that this isn't just about poor oral health outcomes or reduced quality of life. Those are obviously very serious concerns. It's also about the broader health impact and the cost of care when we're looking at this from a systems level and specifically states. When dental care is managed as part of an integrated healthcare system, like what the VA could offer if dental coverage were expanded, there's clear opportunity for cost savings, especially particularly to veterans with chronic conditions. So some of our recent research shows that for every $1 invested in dental care, as part of diabetes management, there's a $1 savings in related medical costs. And with heart disease, it's even more striking. For every $1 spent on preventative oral health care, it can result in $2 saved in heart disease management. So at that point, dental care isn't just a health benefit, it's paying for itself and really part of that healthcare cost infrastructure. This is really important context to keep in mind as we look at chronic disease trends in Idaho and consider what solutions might look like there. Okay, so these are some data points collected through research from AIDPH and CareQuest. They came from Burfus, which is a national survey of veterans administered. This one was in 2021, and from data accessed through the VA. And I'm sharing a quote here. Something to note is we try to take our research is always done in a community engaged manner, as well as we often take it in a mixed methods approach so that we are interviewing and working with our community to hear from them, to give that qualitative data, to work with the quantitative data that I just showed to show that true story. So this is looking at experience of a working age veteran living in Maryland who was unable to afford care even after VA dental insurance program coverage. Just really highlights the need and the help that they are asking for. Okay. So this is a little bit I mentioned, and we can pop it in the chat, Shayla, if you're okay putting it in there, vetdentaldata.org. I talked about at the beginning. I'm going to keep coming back and highlighting the resources that we have available. So we have our publications. We have the state profile that we will talk about in just a minute for your state, but we also have some interactive dashboards there as well. So this is showing interactive insights on rural veterans, cost of care, and state-based indicators, which can be accessed on the site. We have an entire tab dedicated to rural veterans. And while the data aren't available from MEPS, which is Medical Expenditure Panel Survey on a state level, they can be evaluated by region. So you can get sort of a proxy for state level data there. I'm going to show this piece too. When you click further in on that rural tab, it will take you to the interactive dashboard for rural veterans. So across each indicator, it's clear to see that rural veterans delay dental care due to cost, spend more out of pocket on dental care, and struggle to find accessible locations for dental care. And this is all veterans. It's just veterans versus rural veterans on the data dashboard. Okay. Another piece is that rural veterans also feel more impacted from lack of access and utilization of dental care. They often cite that the state of their mouth or their teeth is embarrassing compared to non-rural veterans. And rural veterans also struggle more with a functional dentition, which likely leads to the data points we see around increased cost of care, higher emergency department use, et cetera. This is highlighting the research publications that we have there. I mentioned that at the top of the call. We have several publications, and this is just a snapshot of the research and tools we've developed to help organizations like the ones you all may be working for and others across the country. We want folks to be able to access clear, tangible data about veterans. Okay. All right. So to kick things off, I want to share a little bit about Idaho and give you some background on why we're doing this virtual road tour. So we've developed a set of resources. And if you have not already gone to Vet Dental Data to pull up your state profile and want to call that out, we invite you to pull it up and follow along as we go into those details. If you hover over Idaho on the interactive map, you'll find a detailed profile that outlines what veteran oral health looks like in your state. These profiles were created for all 50 states to provide specific relevant information that's easy to access and use. Okay, so before we dive into the state-specific data, we're going to pause. You can stop hearing from me a second, and we'll get you back on Slido. Please share in one word, naming what you think your state's biggest challenge is for veteran oral health. We'll toggle over here and see what you have to say. And you can see this on, if you lost your page, you can just go to slido.com and put that reference number that's on the screen right here. Eligibility for services, population at the VA versus providers, cost. Okay. All right, eligibility and cost. I'm going to toggle back to our slides, but yeah, I see a couple of folks typing here. I'll give another second. And if we toggle back to the slides and you haven't added your piece yet, please still do so. We like to make sure we capture everyone's thoughts. Okay, so what do these oral health profiles look like for Idaho? Um, we put these together because we kept getting the question, what does veteran oral health look like in my state? So again, we really wanted to, we started at the national level, and that's typically where our research lies, but we really wanted to put together tools for folks to be able to use at the state level. So let's take a look. So starting at the top of the state profile, we open each profile with some quick context. Again, we designed this to be a tool that you in Idaho can take and have conversations with decision makers, program managers, and really share out to reinforce maybe the program ask you're making, the grant ask you're making, the legislative ask you're making. And so we've designed it to facilitate those conversations. So opening the top with some quick context, again, what's happening in Idaho and how it fits into the bigger picture nationally, especially when it comes to dental care access through the VA. So again, we start out making that key point that we always include that most veterans are not eligible for dental care through the VA. I have a hard time hammering this home on these calls because I feel like a broken record, but we find over and over again, even with folks working in dental public health, working with military connected folks, and specifically legislators, that is something that people just don't know. So it's a really important place to start. So when you're starting the conversation, powerful place to begin. And because of that gap at the federal level, when we were talking about that at the beginning, it's the states and local healthcare systems that end up carrying the weight, whether it's disease burden, access issues, or care delivery challenges. It might be decided at the federal level, but it's the states bearing that burden. So we've also included data on where veterans live across Idaho, especially counties with high concentrations. And we pulled in whatever we could find on rural veterans. So you see here, these are the counties with the highest veteran populations that may or may not be rural. More often than not in these state profiles, those are rural counties. And then you can also kind of look at this map up here and see those locations. Veterans are more likely to live in rural areas, and as we know, rural communities already face higher barriers to care and worse health outcomes overall. So right up front, we hope this gives you a useful county level insight to support better informed local decisions about how to deliver care and improve access. So this might tell you where to start or what programs to start with based on what that local piece looks like. Okay. So then we're looking at some state-specific insights. So here is where we compare Idaho to national averages, because without that context, numbers don't mean much, right? So if you're sharing this with a policymaker, a program leader, they might not know if 17% is high, low, somewhere in between. And that national context really makes those numbers make sense. So just really gives you a quick snapshot of where Idaho stands. The other piece here is that you can cross compare with other states, right? So some states might have similar challenges or demographics. And as someone working in Idaho, you probably know which states make the most sense to compare to. Um, there's a profile for every 50 state. You can pull them up and cross compare. We'll look at some maps on how you can do some easy, quick snapshot pieces there too. So earlier we talked about chronic diseases and those high cost, high risk conditions like heart disease and diabetes that are closely connected to oral health. And because those connections came through strongly in our research, we wanted to make it easy for you to highlight them when you're talking to decision makers or planning programs. So in this section, you will also find data on heart disease, diabetes, insurance status, and indentulism, all compared to those national figures. And then we ranked each state across those 4 key outcomes. So you'll see where Idaho falls compared to all 50 states. So when we're looking at these numbers, number 1 is the worst and 50 is the best. So that kind of gives you some context to what these numbers are reflecting here. And if you are interested in how we did the rankings, you can get into the technical details of our analysis on vetdentaldata.org under the methodology piece. Okay, so looking at our grade, again, we wanted it to be a really easily usable tool. And everyone knows what a report card is. Most people have gotten a report card at some point in their lives, and they know what those grades mean. So that is why we took this approach to explaining and giving context to these numbers. So taking a look at where your state is succeeding and exploring why and how you got there. I always like to point out, inevitably, some states have grades that they might not like across the board. Some states, like yourself, they might have an A in some places and not be doing as well in other places. And of course, we want to look at those places that aren't doing well. I always recommend looking where you're doing well is in addition to that. It might give you insight into successful pathways. Why are you doing well in that area? That might inform the way that you approach an area that needs improvement. Additionally, we talked about comparing to other states. If there is a state that has a really similar infrastructure, a really similar political environment, and they're excelling in an area where you are not, there may be colleagues or lessons learned there, connections you can make to find success stories as well. Okay. We're toggling back out to the dashboard here and just highlighting, we talked about cross-comparing those states. The dashboard here that's from Vet Dental Data allows you to quickly gain insights on key indicators. So it just gives you that quick snapshot ability where you can hover over any state and quickly pull up that information, and then you can click to get to their profile and do a little more of a deep dive. Gives you an opportunity to quickly gather the data and an easy visual comparison. Okay. So we have another question for you. This one isn't Slido. We'd love for you to share in the chat. We just went through a lot of data on your state that highlights some of the barriers, but we would love to know if there's a barrier that isn't in the data, but you know is real for veterans in your community. Is there a problem or a barrier that you're seeing that isn't reflected in these pieces that we have? And Shayla, I will, if you want to call anything out that comes into the chat, that would be great. I don't have chat visibility. Okay. As folks ponder that piece and post, oh, do you have something?
Yeah, Jennifer posted transportation, especially in rural and frontier areas.
Yes. That's a really great point. And I will also say too, we talked about the fact that we pulled the quantitative pieces from nationally available, publicly available data sets. And that's of course limited. So we like to pull out those pieces that aren't reflected in the data and encourage folks to think through how we could gather data on those problems or gather more information so that we can find smart solutions there.
Monica also stated that the population in Idaho has grown exponentially and that they just don't have enough space or providers to see all the veterans.
That's really interesting. Um, and really state specific. That's really great local insight. Um, and I'm also curious if Idaho's continuing on that growth trajectory specific to veterans too. Okay.
The comments remind me a lot of the challenges that West Virginia was facing.
Hmm.
A lot of parallels there.
Yeah. And West Virginia is doing a lot of great work. We have our West Virginia VRT on our YouTube and on our Academy if folks are interested in making connections there and hearing about what they're doing. Okay. All right. So I hope going through those details was informative and not overwhelming. What we really want you to take away from this session is, again, conversation, connection, next steps, and how you can leverage this tool in your work. We want you to be able to use the data to illustrate the need. We want you to share the profile and start conversations, take action, and elevate success stories. So I'm going to share some ways that we think that that you could do that. Okay. One of the most powerful things we can do with data is to advocate. And that can look different depending on your role. So maybe you're a provider, a policymaker, maybe you're a veteran yourself. This profile gives you credible local data and it allows you to bring it to decision makers. And those decision makers might be a city council person, state legislators, congressional reps, but it also might be a funder who's deciding to fund you in a program you've developed to address these needs, right? Or your local health department. Advocacy is not always around, it's often around legislation, but not always. There's a lot of other advocacy pieces there. You can also use this information. You could organize a listening session in your community, invite in decision makers to hear veterans speak for themselves. And just a note again, small advocacy actions like calling elected officials, submitting a public comment, sharing this out with someone else really can ripple outward in big ways. Okay, educating to empower. So many people working in healthcare or veteran services don't know how stark the oral health gap is. And that's where the education piece really comes in. So we hope you might find a way to use this profile to, again, you could do something like lead a short talk at your organization's staff meeting, brief a coalition or a partner organization. Transportation was mentioned before. We talk a lot about, especially when we're talking about rural communities, those out of the box partnerships and specifically in rural, partnering with other organizations that might be providing transportation for other things is a really great option for closing that access gap. So when stakeholders are informed, they become allies, and that's how we build momentum. So we really see this as an opportunity to collaborate across silos. Again, bringing someone in, maybe it's from housing or transportation or mental health, food access, and finding a new way to align your efforts. So sorry if you have colleagues in those spaces starting these conversations. Okay, informing strategic decisions. So data can really be a tool for strategic thinking, whether you're leading a nonprofit, managing a health program, or advising on policy. We hope that you can use the state profile to help decide where to focus. I like to point out to the maps, right? So there's county level data of where veterans are. Perhaps there's a rural county with no dental providers. It can really, looking at that overlay of what you have going on at the local level can really inform where to start. It can also help make the case for why you're investing resources where you are. And if you're doing evaluation or reporting on these programs, it gives you a baseline. So here's where we started and here's where we're trying to shift to, right? And I just take a minute and talk about how the profile can be helped to bring in resources. I've mentioned funders and grant providers a few times. Grant makers and funders want to see data and they want to see it grounded in the community, and this profile can give you that. You can really use it as the problem statement, again, explaining the why you're doing a program or the approach that you are, highlights the gaps in care. And again, you're able to cite it to a foundation for what your solution will address and as a benchmark for measuring outcomes and deliverables for a program you may be working on. Okay, so toggling back to your Slido and to our next poll, we want to be leveraging these tools in our research to best serve the work you are doing. So we want to hear from you about what additional tools would be most helpful to the work you have going on. So some options could be educational materials, policy briefs, research findings, training modules. Are there other pieces that would be helpful to your work? Okay, educational materials and training modules. Okay. And I think health literacy was the number two in our very first or second poll. So if folks selected educational materials, if you're interested in popping in the chat more context there, if you're thinking for veterans or patients themselves, is it education materials for decision makers or perhaps even providers on kind of making those connections to care? I'd love to hear the audience on the education materials. Okay, we're pretty well split here. So education materials biggest, but policy briefs, research finding, and training modules. That's great. Thank you everyone for participating there. Okay. Okay. We talked earlier about looking at some specific examples in states where they were successful. And the idea that some of these access pieces are decided at the federal level, but that doesn't mean we can't implement pieces at the state level to affect change. So we want to highlight some success stories there. So looking at Florida, Florida passed legislation creating the Veterans Dental Care Grant Program within the Florida Department of Veterans Affairs. And that program is designed to provide dental care to veterans living in Florida. The department will partner with statewide direct support organizations to administer the program, and the organization will distribute grants to nonprofits with a strong track record of serving veterans. Those nonprofits will deliver care to eligible veterans based on income, service history, other qualifying criteria. So this was new legislation. It was just being implemented in the spring. So we've been saying this year, keep an eye on Florida to see how it's working. It's a really innovative approach. We were excited to see it come together. And Annalise, you can correct me if I'm wrong in the chat, but I think it was just reaffirmed for at least another year of programming. So that to me signals that they're finding success with that. And again, an exciting, innovative approach. Each piece that we're sharing here is a state working within its own environment and what works for their political environment, their constituents, etc. So Oregon developed an innovative Medicaid carve-out specifically for veterans who don't qualify for VA dental benefits or traditional Medicaid. So veterans are first screened to determine if they qualify for either. And then if not, they're enrolled in a local coordinated care organization and receive free dental care through a network of community clinics participating in the program. In Iowa, we have actually had the privilege of doing a lot of specific work in Iowa over the past several years now, starting with a very in-depth research project, which I will talk about in just a second here. But in Iowa, they use state lottery dollars to fund the Veterans Trust Fund, and that fund provides direct grants to veterans to help cover out-of-pocket health expenses, including dental care. So again, an innovative program, and they found a way that worked within the state budget to fund that as well. So I'm going to talk about Iowa a little bit more, and we just like to share this as an example, when a state is activated and ready to focus on veteran oral health a little bit more, what the outcome can be there. So we started in Iowa with an in-depth report. Our research team did about a year-long analysis and published a comprehensive report that was about, I want to say 74 pages, somewhere between 70 and 74 pages. That was an in-depth look at veteran oral health care and also included strategic recommendations with that. From there, our education and leadership team was able to engage with the community through a series of virtual community forums, sharing out the findings and recommendations, and hearing back from the community about what they thought would work and wouldn't work. We culminated that with an in-person Veteran Oral Health Summit in Iowa with community stakeholders, where they really honed in and looked at those strategic recommendations where they thought were the most viable. We shared out those summaries, and we are just now publishing a full strategic report, giving clear pathways on how those stakeholders can move forward on those strategic recommendations that they identified as the most viable. So we're really thrilled with the work that we've been able to do in Iowa. And also, we like to point to this work. This is also all published on vetdentaldata.org, and really a great example of lessons learned and the options that are out there. And these are some of the main strategic recommendations. Number one, of course, being that strengthening and expanding the Iowa Veteran Trust Fund that we shared as a positive solution. Okay. So I would love to pause for a minute. I'm happy to answer any questions if folks have them, and also would love to hear from you on the work that you're doing. So I will pause for a second and see if folks, I'm going to stop sharing my screen for a moment and see if folks have any questions that we can answer.
Liz, I do have one question.
Sure.
So, on the report card, I tried to access the links that were in it, but they all go to a page not found. Have those been
Okay.
updated?
I think our comms team is actually working on updating them. And I
Okay.
should say that's also a great point is that these report cards were published, they're snapshot in time, right? When we're talking about publishing data. So we are also working on doing a full refresh of and check on them and continuing to publish updated ones. I'll take a look at the link. We can email over where that's supposed to go to you, Angie,
Okay,
to the whole group.
perfect. Thank you.
Thank you. Any other questions?
Liz, did you guys do any analysis for, was it just like 65 and under or 65 and up, or was there any like further age stratification?
Annalise, are you able to chime in on that analysis question? Sorry,
Yeah,
you're
I
speaking
can.
English.
So what you're looking at on the state profiles is not stratified by age. The only thing that we did decide to stratify at that time was the line around working age veterans. And I'll tell you why. Because there's an impression that older veterans are covered through Medicare and that working age veterans are covered through the VA. And we actually wanted to debunk some of that myth, so to speak, is that working age veterans are actually not covered by and large, either by Medicare or by the VA, because 75% of them don't qualify for care. So we did not present data in those profiles for older veterans. We just constrained it to a couple of those indicators for working age veterans, and that was the reasoning behind it.
Thank you, Annalise. Are there other questions we can answer? Okay. I would love if just a quick question. I know folks were connecting in the chat, but is there anyone who wants to share out work that you are doing on veteran oral health? It can be the work in general, it can be a success story, or it could be a problem. Yes, Janice.
I want to brag. So our dental hygiene program, which is only 15 students, and it's in 2 locations, but in the past, we've done 1 day of day in the year for veterans to come in for free. And now we've extended that to the whole month of November. So we're trying to do our part to help some of the veterans here right in our area. So I just wanted to share that.
Yeah, that's
I felt kind of
fantastic.
braggy.
No, it's not braggy. That's what we're here for, is to connect.
Yeah. And it's a win-win. The students get excellent experience and the ability to see lots of different situations and work with the veterans. And we've had all ages, and it's really been an amazing thing to do. So, and we partner with Dr. Rader here in Coeur d'Alene, who does a lot for veterans, and he helps us kind of get the word out. We've used the I see somebody's asking, how do we get that out? We have a veterans center here at the college. They get that information out, and again, Dr. Rader, and then word of mouth. The Coeur d'Alene Press has been very instrumental in over the years. So yeah.
That's great. Annalise mentioned in the chat here, we want to capture success stories to share out. Something that we very often hear is, what are other states doing that's successful? What are models we can replicate? What are success stories? And so we like to capture those so we can share them out with everyone asking. And where our goal is to have a compendium report after all of these sessions that we can share those pieces out. Janice, how long has that program been running?
Well, we've just been we've 4.5 years, like it's almost 4.5 years of students. So I've graduated 2 cohorts, and I have the 3rd cohort now, and they're just in their 2nd semester.
That's fantastic.
And
Yeah,
I think
I was kind of flaking going back and forth because we're having a free clinic, kids clinic today. So I was needed in the clinic for a minute. So I missed a little bit of the very first part, but
Well, thank you for being here.
I think
thank
Dr.
you.
Rader has been doing that, his veteran stand down for, I've been in my role for 11 years. I think he's been doing it for at least that long in the Coeur d'Alene area. And I don't know how many dentists he has join him, but I'm so glad that he's partnering with North Idaho College Dental Hygiene now. It's significant for the veteran population and for the students that are working. Great job.
It's opened up the ability for him and the dentist to do more restorative work, and then we take care of the cleanings and preventive things. So.
I'll
Yeah.
add to that. My background is dental hygiene. I'm also in the Coeur d'Alene area, and I have participated in that program with other dentists for many, many years prior. I'm currently with Mouthwatch Dentistry One. We know Annalise as well, where we provide virtual services. We have about 400 dentists nationwide, but we provide essentially a resource, whether it's veterans or other community members, that we can be a really affordable cash pay option, or we do accept government insurance, commercial plans, and so forth. But this has also been kind of on our radar for a while.
Jamie, I want to connect you with Monica Sataki, who had to leave us. Monica's been the dental assistant now with the VA in Boise I just found out a month ago. She's been there for about a year, and it's the first time that I've ever been able to connect with anyone at the Idaho VA. And she definitely is feeling the need for other resources. So I will connect you with Monica.
Yeah, please do. We can provide all kinds of resources, or at least that connection to care, because we know that rural and long wait times are a big issue that face everybody in Idaho.
Yeah, and I will also say, I know, Jenna, specifically in the past, when folks have a day coming up or a month coming up, if you have a flyer or a link or something like that, we can post that with the materials on the Academy and or share out with registrants in an email if that's helpful. Does anyone else have program information they want to share or talk about the work that they're doing? Okay. Oh, Shayna, yes, please.
I would just share that I think most people on the call are familiar with the Grinwell for You program that we have at Delta Dental. It's a free 1-year dental benefit. And we opened up, I guess this is kind of a program and a little bit of a challenge. The program was initially for 60 and up, and then we decided to pilot a younger age group. So we opened it about 2 years ago to 26 to 34-year-olds. And we'd always saved at least 5 spots a quarter for veterans. And then when we opened to that younger age group, we really tried to do some additional outreach, sending information to the VA. I think I sent information to all of like the veteran services at all of the public colleges in Idaho. But we haven't really gotten many referrals. And so it's a resource that's available. And I think it could be taken advantage of. So I just want to make sure everyone knows. And we're exploring opening that program to an even wider age category. So I think it could be a really good resource, especially for those who have restorative needs. And then they have 1 year on that program, and then they're eligible for a subsidized preventive plan. So then it's $10 a month to get a preventive plan where they can get their cleanings, exams, and x-rays. So it's a little bit, that's why I asked Janice, like, how do you get the word out? Because we're seeing that age group has taken advantage. Like we've kind of filled up in terms of, we have at least 20 people a quarter we're enrolling, but we would just love to be able to serve more veterans with that program.
Shayna, I just wanted to comment, part of our intended expansion of vetdentaldata.org is to help promote state-based resources. And that's going to be our focus over the next year, to include points of care. You know, as a national organization who does a lot of place-based work, we've realized that sometimes veterans reach out to us before they might reach out to their local folks, and we want to direct resources into those local opportunities. So thank you for saying that. And I would love to make sure we capture that information so that we can promote it via our website and resources. But that also sounds like a really cool, like promising practice for folks in industry and in corporate settings to support veterans in a really meaningful way. So I just wanted to acknowledge, like, that's really cool, and thank you for sharing that out.
Mhm.
I'm going to pop my email, and Sheena, if we could follow up too to make sure we capture the information correctly for that place that Annalise was saying. And also folks can feel free to reach out to myself or to Shayla with the information shared here today. This is a really great conversation. I'm really excited about the work that all of you are doing, so thank you. I'm going to toggle back to slides real quick so we can talk about our next steps. Okay. All right. So I hope everyone's feeling activated. I think you all came in already very involved in this work, so that's wonderful. I also know that it's a lot of information to take in. We're all busy. So I'm going to try to leave you with just one concrete, easy step to take after this session to keep momentum. And that's share the state profile with one new person or organization. If there was a partner that occurred to you, if you're working on a program, again, kind of thinking through colleagues that might be interested. If you're willing, we'd love to have you post that into the chat of who you're going to share it with. To keep each other engaged and encouraged and accountable to taking that action. And I guess I'm saying one, but I will also say, please follow up with us and share those resources. We would love to have them and be able to share them out. Okay, to that end, our next steps, we said at the beginning of the call, CEU is available with today's session. Those are hosted on our Academy, and Shayla's going to post the link in the chat here to go to get your CEU. You're going to land on a VRT page. You scroll down to your session and click on that, and you can fill out the request form there. We will post recordings and resources from today's session on the Academy on that link. So you can also share that out with colleagues who you think would be interested in this content but weren't able to attend live. We tend to wait a few days to post the recording. Once we post the recording, it's attached to CEU. So it's for folks who want to get that asynchronously, which is great for them. But for those of you who attended live, you would have to click through the video. So we want to give you an opportunity to fill that out and get that without the video. We are also going to post a link in the chat. As part of our advocacy work, we're working to gather stories from veterans in your state with our storytelling forum. Again, pulling in that community voice and that firsthand experience to tie to the data is always incredibly important. It is specifically important when we are doing advocacy work and talking to legislators. So we're really working to get those stories. We're posting a link to the form in the chat, and we would love if you know a veteran or a veteran yourself, if you would be willing to complete that form or share it out with folks that you think would be interested in filling that out. It is all anonymous. And again, you can find the research and the publications from today's presentation on vetdentaldata.org. And we leave you with the idea that veterans deserve equitable oral health. Thank you again for being already working in this space, for being activated and engaging in a wonderful community discussion, and for sharing this information out with stakeholders in your state. We're here, so if you have any follow-up questions, just let us know. And with that, I hope everyone has a wonderful day. And thank you for being here. Take care, everyone.
Thank you. Thanks, everyone.